Hey, it's Chris Beyer.
Chris Bowling.
Brad Johnson here.
How are you, Brad?
I'm doing great. Holiday season, all that good
Yes.
stuff.
Happy Bottom Line Thursday.
Another
Thank
phenomenal newsletter that has been distributed through Mr. Brad Johnson, which we can't wait to talk about.
All right. Well, let's talk about our favorite topic, or at least the favorite topic that tends to come up in client meetings, right?
Yes.
The GLP-1s, people
Yes,
tune in, they know
What's the
we,
latest?
our
yeah.
favorite.
So Prime Therapeutics, as you both know, but for our audience sake, Prime Therapeutics is effectively Blue Cross's pharmacy benefit manager in many states. Not every state, but in many states. And I would argue that PBM, well, let me first tell you about the study we're going to talk about, then I'll give you a little background. So they looked into that question of, okay, what if we covered GLP-1s just for those that are struggling to lose weight, not diabetics, because most
Right.
plans cover that for
Right.
diabetics. What if we isolate it just for those folks struggling to lose weight? Will we see a counter to the drug costs in terms of lower medical costs?
Right.
You know, does it help you out because you're
That's
lower
been the
weight?
that's been the spot that everybody talks about. It's going to help us
Push
reduce
now.
overall cost.
Yep.
Yes.
Yeah, yeah. And so they had 2 years of data, and they looked at non-diabetic patients that were taking this for weight loss.
Okay.
So the appropriate combination that they wanted to take a look at. They did not find a decrease in those taking the drugs on the medical side. They saw
Wow.
their pharmacy costs go up, obviously, because the drug costs something, but they didn't see any type of counter effect on the
Wow.
medical. And they still, in fact, saw the medical costs increase as well. So at least during a 2 year window, and granted, many more studies to come.
Sure.
These drugs are
Sure.
around for a long time, as we hear about all the many things they're trying to use them for. But in that 2 year window, they did not decrease medical costs.
I
I
still
think it's what
think
we've continued to talk
yeah,
about.
it's
If it's
cost.
going to be used for weight loss, we have to have the drug itself cost a fraction of what it is to potentially get the benefit of lower medical costs because other conditions improve. But that's full cost versus medical reduction. It's not showing enough yet. So it's sitting kind of where we've been so far this year.
Yeah.
I was
And
going to
they,
say the
and
same
then
thing.
they went on to even talk about after 2 years, and they anchored back to another study that they did that only 1 in 4 were still taking them after 2 years.
That's good.
Wow.
So yeah, but I don't know if it's just due to cost or didn't like the side effects or
Yeah.
Yeah.
some combination, and so it's really probably tough to do a really long-term study if most of your participants stop taking them after two
Yeah.
years.
Yeah. As you don't have the data to continue to watch.
Yeah. So I'm sure this
Hmm.
is the first of many, but I did find it interesting. A PBM you'd think would promote taking these and actually found the opposite.
Wow.
So
Yeah,
there's the bottom line for the day.
was talking to an employee after an employee meeting. Big boy. I mean, this dude was not just overweight, just one of those big old farm boys. And he was explaining to me what it's like to be on a GLP-1. And he's like, I'm basically nauseous for 4 days. On
Wow.
the fifth day, I finally start feeling like eating. And then on the sixth day, I finally feel okay. And then on the seventh day, I'm jabbing myself all over again, and it starts all over.
Wow.
And he's just like,
That doesn't
it's
sound fun.
not fun. But he's like,
No.
the guy, he was about 400 pounds when he started. He's down to about 320. So it's hard in that scenario, Brad. You can see why these studies might not be long enough. I mean, he's been doing
You
it for
just can't
years.
handle taking it that long. Yeah.
Yeah, but he's like, it's not fun. Anybody that believes that we can't wait to take these drugs, that's not the case. You feel horrible
Interesting.
when you're on them, but it's going to be interesting, I think, as these studies maybe run 3 years, 4 years,
Right.
5 years. I just don't think in 2 years you're changing enough to see any kind of radical change in your medical spend. But you know,
Yeah.
us three have been saying the same thing for the last 2 years. Until these things get down to about $300 a month, it's going to be hard to prove
Very much so.
financially it's worth it. I'm not saying all the other things, but just financially, it's going to be hard to justify them.
Yep. Yep.
Great
Diabetics for
stuff.
sure. They work. They crank those numbers way down. But yeah, the weight loss
Yeah.
question is still up in the air
I love
if
it.
there's a cost benefit.
Sure
Yep.
is. Thanks for digging in.
Yes.
You
Thank you,
bet.
Brad.
All right.
See
See
you,
you
Brad.
guys.
All right.
Take care. All right. Bye bye.
Bye.